Guys, it's Elizabeth, Finding Elizabeth, and this is not my weekly update. I posted that a couple hours ago. There are a couple of educational topics that I've been thinking about posting videos on. I've done one of these before. It's called what I consider the four secrets to weight loss surgery success. I'll post the link below if you're interested. And this one is the 7 reasons why I talked myself out of weight loss surgery for almost 20 years and why that was a big, gigantic mistake. For those of you who don't know me, my name is Elizabeth. I am 49 years old. I am almost 5'5", and my starting weight in the weight loss surgery process was 402 pounds. I had vertical sleeve gastrectomy on April 14th, 2014. So as of today, I'm about, I think like 16 and a half months post-op surgery, and my current weight is about 210 pounds. So that's a total loss of 190 pounds since I started the process, and I am working towards losing another 50. As I mentioned, I'm 49 years old. The very first time I went to consult with a bariatric surgeon, I was 30. My son was just an infant, and he recently turned 19 years old. And at various times between, that was like 1996 and 2014, I reached out for information. I got, information in the mail. I signed up for orientations I didn't go to. I went to an orientation and decided to do OptiFast instead, before I finally got to the point where I was ready to have weight loss surgery. And I made that decision in October of 2013. So, what made me wait so long? How did I talk myself out of this for so many years? And the bottom line is, if you're thinking about it, do it. Don't wait 20 years like I did. It's absolutely the best thing I have ever done, best decision I ever made, and I wish I had done it, 15 years ago. But of course, I believe that everything happens when it's supposed to, so maybe if I would have done it then, I wouldn't have been able to handle some of the emotional turmoil that comes along with weight loss surgery. I don't know if I can handle it now. Well, yeah, maybe I'm a little bit more mature now, so maybe I can. But anyway, these are the 7 things that I told myself that kept me from having weight loss surgery for so long. Number 1, I should be able to do this by myself. Yeah. I told myself that forever. The first time I went to see a bariatric surgeon, I probably only weighed about 20 pounds more than I do right now. And I just thought I didn't think it was the easy way out, but I just thought, why can't I do this by myself? Well, because I can't, because I couldn't, because most people can't, because the percentage of people who maintain a significant weight loss without weight loss surgery is like about that big. And if you've done it, awesome, great for you, but the majority of the people in the world can't do it. So particularly if you have a significant amount of weight to lose. So that's one of the things I told myself. I should be able to do it by myself. Number 2, and this is also part of the I should be able to do it by myself. For most of my son's life, I was a single mom. And as his pretty much primary caretaker, I thought it was irresponsible of me to go have weight loss surgery, risk dying, because I couldn't stop eating and start exercising. I thought that there was a chance of death, which there is, and when I started researching weight loss surgery, it was probably a lot higher than it is right now, but right now the mortality rates for weight loss surgery is less than 1%. So that's a pretty small number of people. So, and I think one of the reasons that I finally allowed myself to have weight loss surgery was because my son was getting ready to go away for college. I had it in April of his senior year, and he left in August to go to school. And although I probably did that because I didn't want him to be dependent on me at the time, turned out to be a pretty good idea, because then I was in a position where I didn't have to worry about making food or keeping junk in the house for anybody else. So that has been helpful along the process. Okay, number 3 reason I talked myself out of weight loss surgery. or the number 3 reason I gave myself for not wanting weight loss surgery. One of the bariatric surgery orientations that I went to, the director of the program was talking about side effects, and he mentioned one woman in particular who, from the moment she had surgery until, some 2 years later, was constantly nauseous. This terrified the shit out of me because I hate being nauseous. And although I was nauseous following surgery for like a day or two, that was about the anesthesia more than anything else. I tend to have a really severe reaction to that. Anytime I have been nauseous since weight loss surgery has had nothing to do with weight loss surgery. It has been the stomach flu, or it has been, I ate something bad or something like that. And I think that that's only happened twice in the last 16 months. I have thrown up post-weight loss surgery, but once you have weight loss surgery, throwing up is very different and does not, at least for me, come with nausea, which is fine. And I've done that maybe 4 times in the last 16 months. I'm okay with that. Hair loss. I was very worried about hair loss. Yeah. I lost hair. I still have, I need a haircut really bad, but there's lots of baby hair still growing in at 16 months post-op. But the bulk of my hair loss was between 4 and 6 months post-op. And even with that, you couldn't really tell I was losing hair. I do have a lot of hair. But you know what? Even if I had lost enough hair for it to be noticeable, there are really good wigs now. And the comparison between losing some hair and losing almost 200 pounds, not even a comparison. One of the things I didn't know pre-op was that hair loss is, if you're eating what you're supposed to be eating and taking the vitamins that you're supposed to be taking, that hair loss is limited to a finite period of time, usually between about 4 and 6 months post-op. So it's not something that lasts forever. So anyway, hair loss, was worried about that. Was worried about, at the time I had really long hair, but now I have short hair. Anyway, doesn't matter. Hair loss, who gives a crap? Loose skin. So one of the things I was worried about is I have seen weight loss surgery patients who look very drawn and unhealthy in the face, and you've seen all the TV shows where people have a huge amount of loose skin. So being on YouTube and part of the weight loss surgery community for, quite a while now, I have hardly ever seen anybody who was on YouTube or the Facebook weight loss surgery community who has that look that I'm talking about, what I call the weight loss surgery patient look. That's what I thought before I had surgery. Now I know that in general, the weight loss surgery patient look, if you're doing what you're supposed to do, is like me. I feel like I look pretty healthy. Maybe a little older and a few more wrinkles since before surgery, but, reasonably healthy. I do have to say that I did go to a conference and noticed a lot of people with that look, mainly older people who might have had surgery earlier on when, the nutritional and vitamin components weren't as well known as they are today. In terms of loose skin on my body, that's more like the face, like really drawn, scary looking face. In terms of loose skin on my body, I've lost almost 200 pounds. I have loose skin. I have a gobble neck. I work out a lot. See, there's my muscle. But I still have loose skin on my arms. I have loose skin on my stomach. But honestly, for having lost almost 200 pounds, it is not that bad. It is way less significant than what I thought it was going to be. And, I feel like I'm fortunate. Some people who've lost as much weight as I have actually have loose skin that gets in the way of their activity. Mine doesn't, never had a rash, never had anything. There's still quite a bit of fat down there. So who knows, that may happen as I lose the rest of my weight. But it hasn't been an issue for me. And, plastic surgery is a possibility. It's out there. You can do it. Loose skin, now the idea of loose skin, not a reason not to have weight loss surgery. Here's another reason I didn't want to have weight loss surgery, because the standard successful weight loss surgery patient maintains a 65% weight loss of their excess body weight. Well, I'm like, fuck that, pardon my French. 65%, I need to lose 100%. And if I can only lose 65%, I don't want to do this. Well, I'm currently at about 78% of my excess body weight lost. 65% then I guess would probably be around 230 pounds. Let me tell you, the difference between 400 pounds and 230 pounds It's a world of difference. Even if I only had lost 65% of my excess body weight, my life would have been exponentially different than it was before I had surgery. So, I'm still shooting for 100%. We'll see if I make it, but 65% would have been a whole total change in the quality of my life. And the last thing, weight regain post-surgery. Well, before surgery, I knew a few people who had weight loss surgery, and all except for one of those people actually gained all their weight back. And it was a very small population, so when I looked at that, I was like, ugh, I don't know. Do I want to do this? Do I want to risk my life to only gain the weight back? Well, here's what I know today. There is a pretty small, most weight loss surgery patients are going to have a little bit of regain, but it is a pretty small percentage of people who gain all their weight back. I think the average amount of weight that people keep off is 50% of their weight loss. I don't want to be there. I don't want to keep off only 50% of my weight loss, but here's what I know today. That is absolutely 150% up to me. The first year post weight loss surgery, you're going to lose weight. You're going to lose weight if you don't change your eating habits. If you just eat small portions of hamburgers and french fries, you're still going to lose weight. But you have to use that time to change your habits and also to strength train. In addition to cardiovascular exercise, you need to strength train so that you can compensate for the changes in your metabolism as it gets used to taking in a small amount of calories. Because let me tell you, year 2 and moving forward, way, way, way harder. And if you haven't changed your eating habits and you are like I am, who still at a year post-op has a lot of weight still to lose, you are going to be screwed. But weight regain is absolutely up to me. Every choice that I make every day determines if I'm going to gain this weight back. So, yeah, those are the things that I told myself to keep me from having weight loss surgery for 20 years. I hope you don't tell yourself the same thing. If you're a candidate for weight loss surgery, if you think it's the right thing for you, I say go for it. Best decision I ever made. All right, if you have any questions about the process, leave them below. Talk to you later. Bye-bye.